From the News Channel 5 Network, this is OpenLine.
Happy Monday to you all. Welcome to Open Line. I'm Jessica Ralston, and tonight, a little different thing. We're doing a Medical Monday and Ask the Dentist. So if you have questions about your teeth, your good oral health, make sure you give us a call here at 737+. Looking forward to hearing from all of you tonight and hearing your questions. Let's introduce our dentist. This is Dr. Anne-Marie Ross, who is with Dixon Dental.
That's right.
Thank you. It's her first time being on the show, so we have to give her a big warm welcome and get those phone lines ringing with all of your questions. All right, so I guess we'll start with the basics until someone calls in. But what are you seeing? What's maybe the biggest issue you all are dealing with at your practice? Do you have something overall?
Overall, the biggest issue you deal with day to day is gingivitis and periodontal disease. So whether it be just related to the gums or the gum and bone, that's probably the thing that comes in the most.
Is it because we're not flossing enough?
That has something to do with it. It does.
I've been given the speech before while being in the dentist chair. But explain why then, how often we need to floss and why it is really, really important.
Ideally, we need to floss every single day. It's the only way to get the stuff from in between your teeth. When you brush, you get what's on the front of them, what's on the back of them, but you're not getting what's in between your teeth. So it harbors bacteria and just sits there and inflames your gum and eventually starts to degrade your bone if you don't do it on a regular basis. It's also the cause of cavities. That bacteria just starts to break down the outer layer of enamel, and once it reaches your dentin, you have decay, which leads to root canals and extractions and all kinds of bad things.
Yeah, that stuff is no fun. And is it periodontal disease or gingivitis that is connected to heart problems?
It is. There's a connection for periodontal disease to heart disease. The same bacteria that are in your mouth can be in your blood, which can reach your heart. It's also related to diabetes and lots of other issues.
That's amazing. I think a lot of people don't understand that, but yeah, I've heard that from the dentist many times, that it's the bacteria that can lead to serious heart problems. So just another reason why you have to get out there and floss. You know, you mentioned root canals. People dread them. Exactly what goes on during a root canal? At what point do you get where you need one?
You need a root canal when the decay reaches the pulp chamber of your tooth, which is the nerve. It can also happen just from trauma. It doesn't always have to be from decay. So it can also be caused sometimes from severe just periodontal issues and the bacteria and infection. So lots of different ways that you can need one. But when we do a root canal, we go into the tooth, remove the blood supply to the tooth, clean it out, irrigate it with some sterile solution and clean it up, and then we fill it with an organic material to replace what we removed. And then when you have a root canal, you always have to have a crown put on top of it because the tooth will get brittle and can break on you otherwise. So it's not finished till you get the crown put on.
Okay. Are you under any sedation during a root canal?
Not always. You can be. You're numb for sure, but you can do nitrous, or if you're really nervous, there are dentists that do IV sedation. There are different levels of sedation. It can range from very mild nitrous oxide all the way to IV. So you can be if you're super nervous, but we do them every day without sedation.
All right. Well, I know you mentioned trauma, and we do have a caller on. Well, we had a caller on the line that we lost just now. Ben, call us back. We lost you. I'm not going to call anyone out, but we have a worker here at News Channel 5 who recently had a little accident and rolled into a bush and damaged his teeth, and he just came back Friday to work, and he had to have a root canal done because he had damaged the front of his teeth. So
right now is a big trauma time. Football and soccer. So you see lots of trauma when these guys are running into each other.
There you go. Yeah, you gotta be careful. All right, so a lot of people call in with health-related questions due to dentistry, and we have here, if someone has headaches in the morning because they clench their teeth while they sleep, what can you do? And a lot of people are teeth clenchers.
They are. I'm a clencher myself. I wear a night guard every single night when I sleep. I'll be honest, sometimes I take it out in the middle of the night unconsciously. I don't know.
Right.
Don't do it on purpose, but I wear a night guard, and it keeps you from being able to do that. When you're clenching your teeth, people can get migraines. You can get a lot of stress fractures in your teeth, or even complete fractures and fracture them. It also causes you to wear away your teeth to where they're very flat, and they can become extremely sensitive, or you can get divots in the front of your teeth from the pressure. So it's really important if you do that to talk to your dentist. There's some different levels of therapy ranging from just a night guard to maybe laser treatments. Some people end up having to have surgery if it gets really severe.
Oh, wow. Okay. All right. Well, we'll get to the night guards again in a second. Hi, Ben. You're back. What's your question?
Yes, I have a question. If you install a bridge on your lower jaw, does the bridge have to touch the upper teeth too, or there should be a gap between them?
Ideally, there is some touching between the bridge and your upper teeth. It isn't going to be extremely heavy because that is really hard on the bridge. It's never going to be your normal tooth, so they're not going to come together quite the same, but ideally you do have some touching.
Thank you so much.
You're welcome.
Okay. Well, that was an easy question. All right. And
was
Eric
easy.
has called in as well. Hi, Eric. What's your question?
Hi. So I wear a retainer every time I go to bed, and I've had my retainer for about 3 or 4 years now,
Right?
and it is really dirty. I mean, it just is plaque infested, and I was wondering what I could use to clean it, because I've tried denture cleaner, and it didn't really work out that well. So is there something like a homemade solution I can make?
I don't know that there's a homemade solution other than the denture cleaner. There is a small little ultrasonic device that it's battery operated that women clean jewelry in. So if you can get your hands on one of those and put some mouthwash or salt water in it and shake it in the ultrasonic, that will clean it. Otherwise, I always welcome my patients to bring anything like that to the office when they're getting their teeth cleaned, and we clean it while you're in the chair, and you get a fresh clean one when you leave.
Ooh, that's a good idea. I'm with you. I have no judgment, Eric, because mine are disgusting as well. And you probably are yours plastic?
Yes.
Yeah, I know. And I use my toothbrush sometimes to go in there and scrub it. And I'm
Using
sure
a
it's...
toothbrush is fine.
Okay.
We don't recommend that you put toothpaste in it
Oh,
because
oops.
it can abrade it, but the toothbrush is fine.
Okay. All right. Well, the jewelry cleaner idea actually sounds really, really good.
Yeah, it's just a little.
Yeah, a little jewelry cleaner with the
Yeah.
ultrasonic, and then you change the solution out, put
Yeah.
mouthwash in. Good stuff. All right, Eric, thanks for your call.
Thank you.
Okay. Hi there, Jason. What's your question? Jay.
Yeah.
Hi. What's your question?
I want to know why that dentists will not work on older people's teeth.
I think let's say most, a lot of dentists do work on older people's teeth. Do you have something specific you're talking about?
You mean what would be wrong
Yes.
with me?
Is it a certain procedure they don't want to do?
Well, let me open up, okay? Me and my lady friends on Medicare. We have health springs. She's got total care. You know what I mean by that, I guess. But I don't. And she needs work on her teeth. And the only thing that I have found to come up with to work on our teeth is to go to a church clinic or Matthew Walker or the school over there at Meharry or whatever. And when you're used to most of your life of having a regular dentist, then you get to a certain age and they don't want to work on you. What's wrong? Teeth or teeth?
It may be that the dentist doesn't take the insurance that you have, in which case you can always call the number on your insurance card and find a dentist that does accept it. Some dentists might be wary of certain medical conditions if you're needing procedures such as extractions or root canals. If you take a lot of different medications or have health issues, that can always be a part of it. But it could be something as simple as just calling your insurance carrier and seeing who does take that insurance near you.
Well, my insurance carrier only pays for cleaning and x-rays.
Okay.
Now, would I go beyond that?
Beyond that, you can still call. A lot of times, even if your insurance only covers preventative stuff, you'll get a discount for carrying the insurance on other dental treatment. So I would recommend calling the number on the card and just asking who accepts it and going to see them and then getting recommendations from there. But I think most dentists do work on a various range of ages.
That's the problem there.
The age?
Ma'am?
Yes.
I can't hear the lady. Oh, well, I got my TV down.
Okay. So she's saying that she thinks most dentists do. Maybe you just have a specific problem with your dentist?
Maybe.
Well, see, that's it. I don't have no certain dentist.
Oh.
Well, it's
We were
definitely
trying
good.
to find one. And the ones that advertise, when you mention Medicare, then we don't work on, they give you a certain age. Now, from what I can see, that is, a person has a right to do their own choosing. I understand that.
Right. Well,
But we're talking about age here now.
Okay. Most dentists, I know in my office we see all age ranges, so I would just call the office and maybe call around a little bit, see if you can find a dentist that you connect with, because most dentists do see all ranges of age, from very young to very old.
Okay, thank you.
You're
All right.
welcome.
Well, thank you for your call. All right, keep those calls coming. We're here with Dr. Anne Marie Ross, who's a dentist with Dixon Dental, and we're going to take your questions throughout the hour. 737+. We'll be right back.